Everyone, my name is Ali Babikir. I'm one of the clinical teaching fellow vascular surgery in one of the hospitals here in London. Today, I'm going to show you how you can take vascular clinical history from a patient. Firstly, you're going to introduce yourself. Hello, my name is Ali. I'm one of the vascular doctor working here. And then you're going to ask for this. You need to confirm your patient name, his age. Age is important because there's a couple of diseases associated with a specific age group. For example, thromboangiitis obliterans, TAO, which we call Berger disease too, is common in young patients. Atherosclerosis is more common in old patients. You will ask also for the gender. Why? Because Raynaud phenomena, I'm going to show you a picture in a minute, is common in young females, and thromboangiitis obliterans and atherosclerosis is more in the males. Occupation and education. You ask for both of these because Berger disease is also associated more with the low socioeconomic status. This picture for Berger's disease, thromboangiitis obliterans, which is a type of vasculitis. It's usually associated with the smoking too. And this is the Raynaud phenomena. As you can see here, when there's normal circulation, the fingertips will be normal. But in coldness, as you can see in the lower of the slide, the tips of the fingers will change to white due to lack of blood flow, then blue due to lack of oxygen, then red when the blood flow returns. Reactive hyperemia, which is basically the blood will return, which will lead to hyperemia. The fingers will be more red than usual. Then secondly, we will ask for the chief complaint. Okay, Mr. John, tell me what brought you today to the hospital. So you will ask for the main complaint that brought the patient to your care today. For vascular, one of the most common complaints is pain. You have to determine, is it right or left while he's walking or at rest. Pain in the legs exclude spinal stenosis. The difference between spinal stenosis and vascular problem, spinal stenosis will get better by changing position. The patient will tell you, when I lean forward, I feel better. The vascular problem is usually the pain will occur after the patient walks for a while, and then the pain will disappear when the patient rests. Also, the patient may complain of ulcer. It could be his chief complaint. You have to ask for how long this ulcer is here and the progress of the ulcer, as I'm going to show you in a minute. And also, the patient may complain of discoloration in the toes or in the feet. You have to determine that, and you have to determine for how long. Okay, then you ask of history of presenting illness. And I divide the history of presenting illness to A, B, C, and D. 3A, history of pain. As you know, you analyze history of pain using Socrates. Site, onset, character, radiation, associated symptoms, timing and duration, exacerbating factors, and severity. After that, I'm going to talk a little bit about site. Site is very important and crucial because every site is associated more with couple of disorders. For example, feet usually associated with thromboangiitis obliterans. And that's why, because this thromboangiitis obliterans or Berger disease affect lower tibial and plantar arteries. And also, as you saw in the picture, Berger disease is more common on the tips of the fingers of the hand. Calf, arterial occlusion of femoropopliteal junction usually will result in pain in the calf. Thigh, occlusion at the opening of the superficial femoral artery. Buttocks or gluteal area, occlusion of bifurcation of the common iliac artery. Also, you need to think about spinal stenosis when the patient complains of pain in the buttocks. So as you can see here, site will give you an idea. That's why it's very important to determine the site. History of discoloration, and I'm trying to make it easier and simple for you. Remember that you can ask using Socrates 2 for history of discoloration. There's some elements here are not applicable for discoloration, but the Socrates mnemonic gonna help you grasp an idea about the discoloration. Ask about the site, the onset. The character is description of the discoloration. Radiation, instead of radiation, think about extent. Why does this ulcer extend? And also, if there's any factor that makes this ulcer worse, if there any associated symptom with this ulcer, is it painful? Is there any itching? So Socrates will help you with the discoloration too. And then 3C, history of ulcer. Also here Socrates will help you. If the patient has ulcer, try to determine the site, the onset, and instead of radiation, think about description, aggravating and relieving factors, and any progression for the ulcer, and if there's any trauma. So using Socrates will help you with pain, with history of pain, with history of discoloration, with history of ulcer too. 3D, we are still in history of presenting illness. 3D, history of other arteries involvement. If the patient has peripheral arterial disease, there is a high chance the rest of the arteries in the body are involved too. So ask the patient for any history of fainting, transient blackouts, maybe cerebrovascular disease or TIA, any chest pain, which may indicate MI or unstable angina, weakness or paresthesia in the upper limb, blurred vision, which may indicate ophthalmic vessels involvement, abdominal pain or any GI symptoms, maybe the patient has mesenteric ischemia. After that, you ask for other history. Ask about fever. It could be secondary to infection in wet gangrene. And also remember, most of the patients with diabetic septic foot will not feel the pain because of the neuropraxia, so they won't feel nothing. History of superficial thrombophlebitis. Ask for any pain or tense and tender thick veins. Usually 30% of the patient with thromboangiitis obliterans, Berger disease, will present with pain and tense, tender, thick veins. Number 4, past history. We finished number 3, history presenting illness with all the subcategories. Now we are at number 4, past history. History of previous cardiac attack or embolic stroke. Past history of such episodes, like episodes of pain or ulcers or discoloration. Any major event in the past. History of surgeries like amputation or sympathectomy for pain relief, lumbar sympathectomy. After that, drug history, any allergies, what the current medication and what the previous medications. Family history, history of such illness in the family, regardless of the presentation of the patient. If the patient presented with pain in the lower calf, if the patient presented with pain in the calf, ask for any history in the family with the same presentation. If it was discoloration, you're going to do the same. Atherosclerosis and hypercholesteremia may be familial too. So risk factors, one of the risk factors for peripheral arterial disease is hypercholesteremia, hypertension and diabetes. All of these could be familial. Personal history, ask about the married status and the children. And why we ask about that? Because history of impotence usually may indicate Leydig syndrome. Smoking, as we said, smoking associated with Berger disease, diabetes and hypertension, both of these are risk factors. All of this in the personal history. And then at the end, you're gonna summarize your presentation. How will you summarize your presentation? Just mention the important positives and important negatives. Make sure to watch Vascular Clinical Examination to complete this session. Thank you and good luck.